Good morning. Today's day of chemo, very first chemo, so I'm not quite sure what to expect other than needle in my arm, of course. But that's okay. I had to take a medication an hour before, so I took one just now and I'm waiting for my ride. Bonita, a dear friend from the old neighborhood, offered to drive me today, stay with me, and then she'll be dropping me back as well. So I'll talk to you guys at the hospital next. All right, here we are. Chemo started. I have an amazing, funny caregiver. His name is Roy, and he's been doing an amazing job making me laugh and making this as easy as possible. So far so good. I asked them to cover up the IV just so I won't pass out, and I'll be here for 2.5 hours. I have company with me today, so they'll keep me busy with conversation, and I have a book that I just got, and there's lots of magazines here. So I also have my music with me that everybody contributed to. Thank you so much, you guys. You sent me amazing songs that'll keep me strong and motivated and going during this time. Okay, so I have about an hour left of chemo. Unfortunately, it had to be stopped temporarily. It's going back in now, but I had the weirdest reaction because as soon as I know or hear what's happening or what's going through, I get lightheaded and I might even pass out. So it started to happen. Luckily, I did not pass out, and the team was amazing, looked after me, gave me an oxygen mask, a mild sedative, and it lasted for about 5 minutes. But then we got the breathing under control, the pain in my stomach was gone, and now everything is okay. So yeah, that was a weird first experience. I'm sure the next one will be so much better, but it was also a little scary because what if this happens every time, or what if we can do chemo because I just can't handle it. But things are doing okay now. I have a nice chamomile tea to keep me warm as well, and warm blankets to keep me toasty. So talk to you guys after. So I decided to take my glasses off, although I can't see very well without them because I don't want to see what's happening across the room from me where other patients are getting their chemo and there's needles being pulled out and they're being treated. So it's better if I just take my glasses off and half blind. Okay, we made it home. So that was a little bit rougher than I anticipated, but not because of the actual treatment, but because of my reaction to the treatment. It is all up here because nothing really hurt, but as soon as someone tells me what is happening or what they are doing, unfortunately, I get lightheaded and I'm close to passing out, which almost happened. I might even had a small panic attack because there was a knot in my stomach, and I couldn't breathe properly, and I was hyperventilating, and I was very, very dizzy and lightheaded. So once we got that under control, chemo was done, and right now I'm just feeling a little woozy, probably because of the sedative they gave me. But other than that, I'm fine. They did say that the side effects might not kick in at all or might start happening later. So for that reason, I have a whole bunch of medications. So I have something for mouth sores. I have something for nausea. I also got a couple of more face masks just in case. And Claritin, as well as extra strength Tylenol in case I get body aches and pains. I also got a schedule for all of the other medications that are supposed to be controlling the side effects of the heavy drugs for chemo. So I'll be going over this just to make sure that I follow all instructions, and then I'll relax for the rest of the afternoon. Haley and I will watch a movie. God bless you. Okay, it's a few hours after chemo and I'm definitely starting to feel woozy, but I have good company, and this little guy is taking care of me and staying with me. So is my daughter, checking on me. There are no pains and aches other than a slight headache, but I decided to maybe remain horizontal and just try to fall asleep. And the cat is purring, so I'm sure sleep is not far away. Right, Bookie? Can you give me kisses? No. Good morning. Well, it's the day after chemo, and I had a bit of a rough night last night with nausea and a vicious headache, I think from the mild sedative they had to give me. Other than that, I would say the first one went well. Not looking forward to the second one, but hopefully the nurse will try to listen this time and make sure he doesn't tell me anything that's happening, because that's what totally triggered the episode that I had. And I really don't think I need to know where the needle is going or what's happening now. So I'll be firmer and I'll make sure that the distractions that I have are perfect and he won't be able to let me know what's happening. But overall, it went well. Today I'm just feeling a little bit weaker than usual, so I didn't go swimming. But I'm up and about, and with small breaks, I'm still able to keep to a normal routine. And I have my daughter who is making me breakfast right about now, so that will be awesome. And the nurse is coming later to give me the first injection after chemo. And that'll be the routine moving forward. So looking forward to a nice uneventful morning. I'll read a little, maybe watch a movie and pass the time.